Hello, my name is Maya Vasquez, and I am a school psychology student. I am currently placed in an elementary school setting, but I have also worked within the middle school. So today I will be demonstrating a mock individual counseling session using cognitive behavior therapy or CBT strategies. And for the purpose of this mock counseling demonstration, I will be portraying both the school psychologist and the student so that I can clearly demonstrate how CBT techniques can be applied within an individual school counseling session. So, the focus of this session in particular is negative self talk related to test anxiety. Many middle school students experience anxiety before exams, which often includes thoughts such as I'm going to fail or I'm not smart enough, and CBT is an appropriate approach because it really helps students recognize how their thoughts influence their emotions and behaviors and teaches them practical skills to challenge negative thinking patterns. So, for the background, for this session, I will be working with Alex, who will be a seventh grade student that reports feeling anxious and discouraged before math tests. So, Alex often experiences racing thoughts and negative beliefs about his ability to succeed academically. And teachers have reported that he is capable but is very hesitant to participate in class when he feels unsure. So, the goal of this session is to help Alex recognize negative thinking patterns and to develop healthier, more balanced thoughts using CBT strategies. Hi, Alex. I'm glad you came in today. Your teacher mentioned that tests have been feeling stressful lately. Can you tell me what usually goes through your mind before a math test? I usually always think how I'm going to fail. Okay, yeah, that sounds like a really stressful thought. So let's think of something first. This is called CBT. So, with CBT, we look at how our thoughts, feelings, and behaviors are connected. So, let me break it down for you real quickly. So, we are going to be using something called the ABC model. So, the A stands for the activating event. For you, it would be taking your math test, and the B would be belief. And that belief would most likely be how you think I'm going to fail. And lastly, the C is consequence. So the consequence in your scenario is feeling anxious or nervous about the test. Do you think that sounds like what's happening to you? Yeah, that's basically what happens. Okay, so now let's look at that thought together. When your brain says, I'm going to fail, let's ask a question. What evidence do we have that this is always true? I don't always fail. Right, sometimes our brains jump to the worst case scenario. So, what might be a more balanced thought you could tell yourself? I think that maybe I might do okay. I think that that's a really great start. Maybe something like, I studied and I'll try my best, will work out. Let's see. So, another CBT tool is called a thought record. This helps students track situations that cause strong feelings. So, if we wrote this down, it might look like this. So, first, the situation, which is the math test. Second is the thought, I'm going to fail. And third is feeling. So, feeling nervous. And lastly, the new thought, I prepared and I'll try my best, just like we discussed earlier. So, writing thoughts down can help you notice patterns and practice changing them. Yeah, that kind of makes sense. I'm glad you think that. So, we're going to test your thought. So, sometimes our brain predicts things that aren't actually true. So, here's an experiment we could try. Maybe during your next math class, raise your hand to answer one question. What do you think might happen if you do that? I think that I might get it wrong. Sure, that's possible, but what else could happen? I could get it right. Exactly. This experiment will help us collect evidence instead of assuming the worst. Maybe you could get it right. Okay, so now for our last CBT tool, it is called a coping card. So this is a small card you can keep in your notebook with reminders when you start feeling anxious. So your coping card might say, take a slow breath, I studied and prepared, and one test does not define who I am. Do you think having something like this could help during tests? Yeah, that could probably help me. So that's fantastic to hear. And just to finish up, we'll do a little repeat of what we talked about today. So, we talked about how our thoughts, feelings, and behaviors are connected. We practiced identifying negative thoughts, challenging those thoughts, and replacing them with more balanced ones. And we also created a small experiment and a coping strategy you can use during tests. What part felt the most helpful to you today? I think what stuck out to me is changing the thought that I have that I'll fail. That's great. That's a really powerful skill, and it gets easier with practice. And I think that you will really benefit from it. Thank you so much for talking to me today. I can't wait to hear how everything went. Okay, so CBT is an effective counseling approach for students experiencing academic anxiety because it focuses on the relationship between thoughts, emotions, and behaviors. And research shows that CBT based interventions can significantly reduce anxiety and improve coping skills among students. So, the ABC model helps students understand how thoughts influence emotional reactions, and cognitive restructuring teaches students to challenge distorted beliefs and replace them with balanced thinking. So, thought records promote awareness of thought patterns, while behavioral experiments allow students to test assumptions in real situations. Finally, the coping cards provide accessible reminders that reinforce adaptive thinking during stressful situations. And together, these CBT strategies really promote emotional regulation, realistic self appraisal, and increased confidence in academic settings. In conclusion, cognitive behavioral therapy provides students with practical tools to identify and challenge negative thought patterns that contribute to anxiety and low confidence by learning to reframe their thinking and test their beliefs. And students can develop stronger coping skills and approach academic challenges with greater resilience. Thank you.